Aloha, I'm Jason Blake, the Medicare Geek. My goal is to help my Medicare clients succeed and to help agents who are working Medicare products to get their books to 500 Medicare Advantage plans and growing. The first topic I want to talk about today is the 2 ways to get Medicare. Medicare is the U.S.'s socialized medical program. It is for people who are age 65 or older, and also for people who are on Social Security disability for at least 2 years. Medicare Part A. Who knows what Medicare Part A is? It's hospital insurance. Generally speaking, though, this is just the nights in the hospital room. Medicare Part A, if you've worked an average of about 10 years in life and paid taxes, it doesn't cost you anything. You're technically entitled to Medicare Part A. The second thing is Medicare Part B. Who knows what Medicare Part B is? Medicare Part B is simply medical. And to make that real for you, that's anything that requires a provider, a doctor visit, a surgeon, a technician to read an MRI report. Medicare Part B has a cost for most people. This year is 2018, and most people pay $134 per month for Medicare Part B. If you're collecting Social Security, it comes right out of your check. If you're not collecting, you pay it quarterly. If you're higher income, that means for a single person, your adjusted gross income is above $80,000 a year. This amount goes up on a sliding scale. And if you're low income, in many states, the Medicaid system can step in and pick that cost up for you. Do Medicare A and B cover everything? Absolutely not. The old-fashioned way that most people used to do is called a Medicare supplement, also known as Medigap. Medigap plans are kind of like car insurance. How much you pay ends up with how much coverage you end up getting. They have weird letters like C, F, N. A very popular one for people turning 65 is Medicare Supplement Plan F. Right now in Hawaii, someone turning 65 can get a Medicare Plan F for about $130 to $140 per month. The benefit to a Medicare Supplement Plan F is it takes away the deductibles for Parts A and B, and it also helps cover that 80-20 split that people hear about with Medicare Part B. So the great thing about a Medicare Supplement F is that you can walk away from any medical expenses. But who knows what's missing from this? Prescription drugs, because when Medicare came to be, there was no such thing as prescription drug programs. So in 2006, the government came up with what was called Medicare Part D. These are drug plans offered through private insurance companies that you get to help with your prescription drug costs. On average, these plans cost anywhere from $20 to $80 per month. Most people can get a good one for anywhere from $20 to $40 per month. Is this the only way to get Medicare? Absolutely not, because if you look, this can kind of start to add up. $134 for Medicare Part B. If you go with the Plan F, another $130. That goes up every year. Maybe another $30, $40. You can easily have costs of $250 to $350 per month, depending on which way you go. Still cheaper than private insurance at age 65 or older, but certainly not cheap by any stretch of the imagination. So there's another way that most of my clients actually do, and it's called Medicare Advantage. Also known as Medicare Part C, not to be confused with Medicare Supplement C. I didn't make the rules, but that's what it is. To be eligible for Medicare Advantage plan, you have to have Medicare A and B, which you're going to if you're going to have Medicare anyway. You have to live in the plan service area. This is usually just a group of counties because most Medicare plans are county and zip code based. For instance, I live in Hawaii, and 4 counties encompass most of the plans that we have over here. You also cannot have ESRD. If you don't know what ESRD is, you probably don't have it. ESRD stands for end-stage renal disease, and that means your kidneys are failing, you're going to need a kidney transplant, you're on regular dialysis, you're usually on a whole bunch of medications. Medicare has a special program for people on that. So as long as you can say, yes, I have Medicare A and B, yes, I live in the service area, and no, I do not have end-stage renal disease, you are eligible for Medicare Advantage. There are several different types of Medicare Advantage plans, but most of the time, with very few exceptions, you only want to get a Medicare Advantage plan that includes that Medicare prescription Part D coverage, because you can't have a separate Part C and Part D in most cases. And most of these plans, there are some other exceptions, most of the plans that you'll see in the United States right now are HMOs and PPOs. You have the cost of $134 per month, but if you qualify for Medicare Advantage, many places in the country have Medicare Advantage plans that start at an additional $0 per month. In our area, we have great plans that go anywhere from $0 to $52 per month. So from a monthly cost perspective, you can definitely see why many people gravitate toward the Medicare Advantage viewpoint. Are there pros and cons to both sides? Absolutely. Are there reasons many people choose Medicare Advantage? Absolutely. And then counterintuitively sometimes, since these are managed by private companies, you also can get extra benefits like dental care, hearing aid support, sometimes even free gym membership. So that's the 2 ways to get Medicare. I'll have a follow-up presentation to kind of talk about some of the pros and cons of going what they call original Medicare, which would be this route over here, and also Medicare Advantage, which would be this side. Any questions, just email me at jason@themedicaregeek.com and I will get back to you within a week.